Okay, so Dr. Hooijer, welcome to the last session on parental involvement for today. And you're going to be speaking about family dynamics, if that looks correct by your title.
Yes, that's correct.
Okay, and over to you. You can do your presentation and then we'll take some questions at the end.
Okay. Good morning, everyone. I hope you've had a very fruitful morning. I listened to some of what Mr. Mohammed was saying. It was very, very interesting. As I said to you last week, we were going to finish off with Unit 2 this week, and we're going to talk about family dynamics. But before we get into that, let's just talk about the importance of Unit 2 and why Unit 2 is part of this module. So the information here in Unit 2, it's important because it's there to remind us that when we are dealing with a child who is in need and needs support, or even any of the children in your class, we need to be mindful of the bigger picture of where they come from, who they are, what their family is like. We need to know that to be able to support them properly. We need to understand that there are different families and that there are different family contexts, different family structures. And we need to know that so that all this theory that we are learning across the ADE module, and in particular when we are dealing with a child, we need to know what that is, their family context is, so that we can help them by integrating the theory that we know with their context, so that we're not asking them to do something that is foreign to them, and we're not asking them to do something that is impossible in their context, so that we can benefit them all. And that will help us to best support the learners that are struggling to learn. So to be effective, we must be able to collaborate with families to support the learner's success. We can only collaborate with people if we know something about their background and something about the context from which they come, so that the support that we are giving them can ensure success, because the support is matched with the context that they come from, if that makes sense. So while doing that, teachers need to have different knowledge and skills to meet today's challenges. So we know that there are a lot of challenges in the schooling system at the moment, and you will come across challenges in your classroom. So we need to have the understanding and the competencies to work with diverse learners and their families and their challenges, to help them in their challenges. We can't solve them for them, but we can perhaps support them through it and help them get through it. When teachers understand families, we can then communicate and build relationships with them, and then the learners will benefit. So if we know where they're coming from and we know what they're like, it helps us to communicate better with them, and it helps us to build relationships with them on the right level, so that we're not speaking above them and we're not speaking down to them, but we can build meaningful relationships so that the learners can benefit. So far in Unit 2, we have discussed what is a family. We defined what a family is. We defined the different kinds of family structures that we found. We've discussed last week about functional families and how functional families work and what the characteristics of functional families are. And we also discussed the different family contexts that our children in our classrooms will come from. So today we're going to continue with the discussion, and we're going to talk more about family dynamics. But before we talk about that, we need to understand what research is saying to us about teachers and the understanding of families. There are a lot of research studies and papers written on this topic about understanding families. And the research has been done across a lot of different disciplines. It's not just in the educational context. So in the medical profession, where different medical professionals such as doctors, pediatricians, psychologists, and social workers all learn about the different kind of families and family contexts and family structures so that we can understand them and we can help them within their context. So what do these findings actually say about what teachers understand about families? So here are some of the research findings, and I'm not going to go to them in great detail, but just going to discuss each one briefly. The findings found that teachers often report that they don't know how to engage families. And yes, this can be quite daunting. Hence, we are giving you backgrounds and ideas of what to look for in this particular module and how to engage with families, how to get them involved, and how to communicate with them, with the emphasis of helping all children, and especially those children who are struggling to learn, so that we can support them and improve their learning outcome. So another finding was that some teachers underestimate the importance of family engagement, which then contributes to the lack of adequate support outside the classroom. So if you are not understanding the importance of engaging the family, then you might not take the time to find out what is the context and what best supports that particular family. Then the support that has been given to the child outside of the classroom might not be adequate enough to help them. So it's important to know that families are essential to the learning of a child and the effective learning of a child. So another finding was that teachers view the lack of support from parents as one of their most difficult challenges. Yes, that is true. You often hear that we had a parent evening last night, but the parents I really needed to see did not come. Or I've tried to get hold of this family time and time again, but the phone just rings and rings. Or the phone numbers and the contact that I have for this family, I can't get hold of them. So this can be one of the most difficult challenges, and we need to find innovative ways to try and get around that. And of course, if you can't get hold of the family to discuss the challenge and to give them some support, obviously the child is not going to be supported. Another finding was that the way teachers understand families impacts the way they feel about family-school relationships. So that is why we're trying to give you this broad understanding of family structures, family contexts, so that you can best understand how families work, how the families you are dealing with in your context work, what to look for, what characteristics to find, so that you can then have good interactions with those families, and that the expectations for the learner's academic and social development can be improved if you understand how the families work and what the impact of the family interaction is on the child's academic and social development. And then, of course, the research also said that for teachers to be able to work effectively with families, teachers need to have humility. So in other words, we need to not come across as being the person that knows everything, because even we all still learning. I think even Dr. Jean would tell you that we all still learning in this field. You need to have humility when dealing with people, especially families. You need to have a cultural sensitivity. That doesn't mean that you need to agree with everything that is going on, but you need to have a cultural sensitivity so that you respect what is happening within each family, particularly culturally. You need to be an active and perceptive listener. So having done your counseling assignment, you will now have understood what active listening is. And perhaps it will help you to gain more information and more insight into families when you use the technique of active listening and perceptive listening when you are interviewing and talking to families. And then to focus on what families and children do well. And that was another aspect of the counseling assignment, with the solution-focused part of it, where you are focusing on what the families and the children do well. You're not necessarily only focusing on the problem. You're focusing on what they do well so that you can use what they are doing well to help them to address some of the problems. for a more effective outcome. Okay, so right, let's get into engaging families. So being able to engage with families is an essential factor for effective teaching and learning for all children, not just for children that are struggling or that children are in need of support. So we need to ensure that all families and the children feel welcomed regardless of their diversity. So quite often we find that families with children that have diverse issues, maybe there's an autistic child or a child with ADHD in the family, they are very nervous to engage with other families and to engage at the school because they feel they're being judged. And you do quite often hear, I don't want my child in the class with that child. So we want to be able to engage with families effectively and to be able to benefit all families in the school environment. So although giving ideas on how to engage families, and that will be dealt with in more detail in later sessions, I just want to give a couple of ideas for now so that you can start thinking about how you can involve and engage with families a little bit better than what we have been doing perhaps in the past. So these are not the only ways, and they by no means the best ways to do it. There are plenty other ways. So one of the big things is to make communication accessible for all families. So sometimes, because of the family situation and their context and what is happening in their world, they are not able to come to all the meetings that we set. So we have to be aware of that. We have to be aware of the families that can't come. And we also have to be aware on the other side of families that cannot attend online meetings. If they don't have access or computer knowledge to be able to access the different apps for online communication, we need to know that so that we don't exclude anybody by accident from being able to access all the communication. So I know it's quite a big thing at the moment that a lot of schools have got WhatsApp groups for their parents, or they've got Google Classroom where a lot of important information is given to parents. But what if the parent can't access that or their internet is down? We have to think of this kind of thing. Then they miss important information. We have to ensure that all families can participate in school events. So one of the points that is relevant with this is that often school events are planned to suit the school or the governing body or the board of trustees or whatever. And then it's put out to the parents, here's an event, please come along. So I think what we need to also do is start thinking about the context of the families that our school is in, and thinking now, is this the best way to have an event? Is this the best event that we can plan for the families that we want to reach? So I think that's an important thing to think about, just something to think about. Another thing with that one, ensure that all families can participate in school events. Many times when there's a school event like a prize giving or even a parent meeting, so you're either calling the parents in to celebrate the best achievements, either in sport or in academics, or you're calling the parents in because there's a problem. There's that whole big space in between the good and the problem that we need to try and include families in to celebrate the ordinary things that are happening. So, for example, something that could be done is you could have a day when all the projects, a lot of schools do projects are in the curriculum, where all the projects are displayed, the good ones, the bad ones, the medium ones, they're all displayed so people can come along and have a look at everybody's work and everybody feels valued because none are put more important than others. So that kind of thing can be done. A very important thing, learn about the cultural identities and beliefs of the families of the learners in your class. One of the ideas there is that we do celebrate Heritage Day, but you can celebrate different cultural heroes on different days, particularly the days when they were born, or the days that they achieved their status. So there is a calendar out with all of these things on. I'm not quite sure what it's called. I can't remember right offhand, but it tells you all about these people, and many of these heroes we don't even know about. And they have contributed to the community and to our greater world of knowledge. Another thing that you can do is celebrate the traditional clothes or the traditional food of everybody, and let everybody be involved that way, so that people incidentally learn about other beliefs and other cultures. This is a very important one for me, is to create a sense of belonging for all children. So every child needs to be accepted and valued, not just the good ones, and the problems don't have to just always be highlighted. So it's very important to have different functions where everybody can be involved. So, for example, what I'm thinking about now is something like a sports day. When you have a sports day, let every child participate in the team or in a team. So schools don't like to do that. They don't like to give every child a chance, because their eye is on the cup. They want to win the cup. They want to win the tournament, and we can't put that child in because he can't play soccer. So, but we need to think of ways that we can create a sense of belonging for all the children, so that they all feel part of the school, and they understand that the school accepts them and values them themselves. And then another thing, give families some ideas on how to help their children's learning at home. Now, there is a whole unit on that, and we will come to that later in the module. But one thing that I wanted to highlight here was that very often, particularly at the beginning of the year, when you have a parents' meeting and you want to engage the families, they come in and the parents' meeting is often about, this is how the school operates. These are the school rules. Yeah, this is the uniform. These are the school fees. This is how the homework is going to be given out. This is the assessment timetable. So you're giving them ideas on how the school operates. A very good way then is at the same time to make it valuable for the parents, because many of those parents sitting there, this is not their first time that they've sat in a meeting like that, and they know about it. That is to give them some practical ways, or at least one practical way in which they can support their children at home, knowing the way the school operates. So, for example, one of the ways is encourage the parents to sit with the children and go through the school rules, or to sit with the children and plan their own homework routine, so that everybody knows in the family knows when homework will be done and how it will be done and whose responsibility it will be to help the children with the homework. Okay, let's move on to the next one. Let's talk about family dynamics. So family dynamics refers to the way different family members influence each other's thoughts, beliefs, and behaviors. So in the purple box there, you've got a common definition, which is used by many different professionals. This isn't just an educational definition, it's a definition used by different professionals. It's the ways that family members interact with one another, and it's commonly referred to as family dynamics. They are heavily influenced by culture, traditions, family history, so often it's intergenerational. The learned skills that one family passes down from generation to generation, emotions and how they are dealt with, and the rules and hierarchy within a family. So within a family, there are people with different roles. So there might be somebody who's in charge of the nurturing. There might be somebody who's in charge of discipline. There might be somebody who's in charge of the money. So there are different roles within each family. So family dynamic patterns affect the behaviors and the relationships we see within a specific family environment. So sometimes you might hear a teacher say, I understand now what is going on with that child because I've now had a discussion with the family, because you've understood what the family dynamics are. Family dynamics have a significant impact on how individuals perceive themselves, other people, and the world. So essentially, family dynamics contribute to the overall health and well-being of the family, which in turn influences the behavior of the individuals within that family and, of course, the children. Now, while no family is perfect, some families do display toxic dynamics, family dynamics. So this is as opposed to the functional families that we talked about last time and the characteristics of functional families. So in toxic families, their behaviors are almost always destructive and harmful, which can significantly affect families' members' mental health. This is not just occasional conflict. Okay, these are unhealthy behavior patterns that are often unrelenting. So unrelenting means that they happen again and again and again, and no one corrects them until they become the norm within the family. So much so that affected family members, they don't recognize the harmful behaviors. So you might have seen that in a wider community that you've been on or whatever, where you're saying, well, gee whiz, don't they recognize that that's not the way you're supposed to behave in this situation? It's because of this. These unhealthy behaviors have become the norm, and people don't ever correct them. And then you don't understand what is wrong and what is right within certain behaviors. So unhealthy behavior patterns include, but they're not limited to, disrespect for adults, for the government, for other people, manipulation, where members within the family are manipulated, poor communication skills, where things are not communicated, they're not discussed, decisions are just made impulsively, lying, where family members are encouraged to lie about a lot of different things. Sometimes people lie for survival and protection, but it becomes a habit. So people lie about a lot of things. And poor conflict resolution skills. So when there's conflict, there's no positive way of sorting it out. And unhealthy behavior becomes the way that you settle conflicts. The problem with toxic family dynamics is it makes it challenging for children to develop into healthy adults. And it can cause confusion, because when children come to school, they've learned one way of dealing with a problem at home, which might be an unhealthy way. And then they see another way of somebody handling a problem in class or in another family, and they become confused. It can cause chaos, because when children start to think for themselves, then they don't know what to do. Causes conflict, causes stress. And in severe cases, it causes instability, and it can cause emotional harm. Let's look a little bit more closely at some of the difficulties caused by toxic family dynamics. So children can be subject to problematic and challenging dynamics regardless of the type of parent they live with, type of family they live in, or the context their family finds themselves in. This is an important point, because toxic family dynamics can happen in any of the contexts that we have talked about. They can develop in any of the family structures that we have talked about. It doesn't mean that because you have access to resources and you live in a very nice house that you won't have a toxic family dynamic. It doesn't mean that because you are poor and you have very little and there's no resources that you have a toxic family dynamic. It can happen across the spectrum in any type of family. Family violence often erupts when there's an abuse of power or trust. So where an adult, it's usually an adult, and unfortunately, it's usually the male in the family that there's an abuse of power, and it threatens the survival, the security, or the well-being of a family member. And unfortunately, quite often, the family member that it is targeted against most is usually a woman, because a woman is seen as defenseless and not as strong as a man. And sometimes it's targeted towards the children. So the children find themselves in this issue of violence that is happening within the home. And this violence can be physical, it can be emotional, it can be financial, where there's money, but it's restricted. It can be ritualistic, depending on different beliefs in the family. It can be sexual, it can be religious, or it can be social. And this all has a harmful effect on the family as a whole. Such family problems, they can cause anxiety. So you might see the child that is extremely anxious in class, very eager to please, and very anxious if things go wrong. And you sometimes see that anxiety on the face of a child when a teacher is reprimanding a group of children. And there might be one child in that group that almost falls apart, or you see the absolute recoil in their face because they know what happens from experience in the home when people start shouting and screaming. It can cause sadness. These are your children that tend to withdraw and don't get involved in anything. And it can be anger, where the child acts out and might take that anger out on things in the classroom or on other children. The family members that are part of a toxic family dynamic can feel isolated. So they can feel confused, they can feel exhausted because it's tiring dealing with all of this. Nothing runs smoothly, and they can feel extremely stressed when they experience family problems. So these families might not respond to invitations to come to school, and they might not attend any school function because they don't want to interact with other people, and definitely not with other families, because they don't want others to know what is going on, and they also don't have time for it because they're too busy dealing with what is going on within themselves. So family dynamics can also influence the way you plan your lessons and your classroom management, because they bring various religious beliefs. So for example, an example here is particularly with foundation phase children, when just before the children eat, the teachers might like the children to sing a little song to give thanks for the food. And there might be some parents who, because of their religious beliefs, object to that. So you have to find a way to accommodate all people within that scenario. Cultural backgrounds and traditions can bring changes, and discipline philosophies. If there's a different discipline philosophy within the family dynamic, say, for example, there's no rules at home. Well, why should the child then follow the rules at school? If the mom says to the child, do your homework, and the child says no, the child's going to come to class and they're going to try it. The teacher's going to say, do some work, and the child says no. So those kind of things can impact the classroom and the educational context. Now let's look at the next slide. So in Unit 2, in the Learning Guide discusses some challenging family dynamics. So we're just going to talk briefly about some of these. The thing is, when you work closely with children and they begin to trust you, they will start to tell you things that are happening to them and things that are on their mind, particularly small children, because they can't think about anything else. They can't push it to the back of their mind like some of us can. So most of the time, it's good things. And I'm emphasizing most of the time, it's good things. So they will tell you about, I got a new puppy. It's my mom's birthday today. We're going to go out for supper. My auntie had a new baby. But other times it can be more sinister and you need to monitor what is going on. So it could be something like, I'm hungry. There was no food at home today. My granny died last night. Or even my dad was arrested. But the child has trusted you, and then you need to be in a position to be able to give them some support. Now, some of these challenging family dynamics that are mentioned in the study guide, we're just going to go through some of them quite quickly. These situations might be familiar to a lot of you. Fortunately, they are not the norm, but we do encounter them more often than we'd like to. And we do encounter them more often when children are struggling to learn. So a big thing in South Africa is alcoholism in the home. So this is the abuse of alcohol by a family member or by the family itself. It's a growing problem in South Africa. You might have seen different NGOs and things on the news are talking about this. It can result in neglect, lack of care, conflict, money issues, all those kind of things. It can also result in the child being emotionally, physically, and or sexually abused when there's alcohol being abused in the home. If the mother is the one that is abusing alcohol, she's then not able to give the nurturing care that a mother usually gives to the child, and a child might have to take over that function within the family. She can't look after the needs of the child, can't do the washing, the cooking, that kind of thing. If it's the father who has the drinking problem, obviously he's not going to be able to provide for the family because he either can't keep employment or the money that he does get is used on alcohol. So this results in children that are anxious, fearful, they're hungry, they can be sleep deprived. So we talk about that as being hypervigilant, because children, it's not that they are kept awake, it's that they stay awake because they're wanting to see what is going on and to make sure that they are safe. They're too scared to fall asleep. It's called hypervigilance. They can be malnourished because there's not enough food in the house. There can be social difficulties. FAS is a problem. And I just want to talk a couple of minutes about FAS. So FAS is fetal alcohol syndrome. So according to a 2021 study, globally, that's internationally, for every 1,000 births in the world, internationally, 1.5 babies, that's a percentage, it's a statistical thing, 1.5 babies will be born with fetal alcohol syndrome. But here's the shocking thing. In South Africa, for every 1,000 births, 58 children will have fetal alcohol syndrome. We in South Africa have the highest prevalence of fetal alcohol syndrome. The problem with fetal alcohol syndrome is that alcohol is a toxin. If a mother drinks during pregnancy, the alcohol can affect the development of the fetus. How does it do this? It's one of the leading causes of neurodevelopmental disorders. What type of disorders are we talking about? We're talking about congenital malformations. We're talking about growth delays, intellectual disability, behavioral disorders such as hyperactivity and impulsivity, speech and language difficulties, or visual and audiological impairments. And at the bottom of the rank, it can cause learning problems. So fetal alcohol syndrome is a huge problem. Closely related to that are Shebeen homes. So Shebeen home is a slightly different problem because this is the family business. And because it's the family business, children are often asked to serve customers and they stay up late because there's no one supervising them going to bed and they're helping. It creates a very unhealthy atmosphere at home. Many of these children witness inappropriate behavior. I don't have to define for you what the inappropriate behavior is. And they also hear inappropriate language, which they sometimes repeat at school and you have to deal with. Associated with this is all types of illegal activities, such as substance abuse, prostitution, and different forms of crime. When the customers stay overnight, because they can't go home, they can't get themselves home, the children are at risk because who knows what they get up to or they think about with the children. School then is not a priority because the business is a priority. And the parents don't want to chase away the customers because that's their livelihood. So that's another thing that we have to think about when we are supporting them. Chronic illnesses. So some of the major illnesses that are dealt with is epilepsy, TB, asthma, diabetes, hypertension, HIV, AIDS. All of these are prevalent and sometimes they are not able to get the correct treatment for various reasons depending on the context. TB can become worse because you can be dealing with XDR and MDR TB, extreme drug resistant TB, and multi-drug resistant TB. Many of these illnesses require a lot of care and they require money for medication. So often the sick person is considered first as the whole family is affected. If you think about COVID, a number of children did not come to school even when it was just every second day because they had a vulnerable person at home. And many of them were later coming back to school when the restrictions were lifted a bit because they were considering the sick person at home. So this can affect time, finances, the chores. Many children have to take over the chores that the sick person would have done. It can affect school attendance because if one of the parents is ill, the other parent is the breadwinner. Who's looking after the person that's sick? Sometimes the child has to stay at home and look after the child that is sick. So there's very, very different needs for support. And this is where, when you are doing an IEP, where it comes into collaborative networks, you're finding the type of support that is available in the community, in that ecosystemic diagram that you've been drawing, to find out what support there is within the community to help people like this. And then poverty. large families, single, unmarried mothers, teenage mothers, unemployment. We talked about the migrant work where the parents work far away from where they're living. They again have inadequate resources, overcrowding, poor water and sanitation, poor nutrition, and sometimes no access to proper healthcare facilities for whatever reason. This can result in neglect, it can result in abuse, it can result in the types of abuse, physical abuse, neurological abuse, cognitive, scholastic, emotional, and social problems. And again, support is needed from the community. So it's a good idea to find out what is available in the community, who you can refer to. Sometimes there are peer groups, sometimes there are neighbors that can help, sometimes there are church groups that can help, NGOs, all those kind of things. Now, the last one here is a very serious one. The last challenging family dynamic. It's a very serious one. It's abuse. So this has been in the news recently, and it sparked a number of protests around the country, especially concerning the tragic incident of the little 7-year-old girl who was allegedly raped at school in the Eastern Cape. She's unfortunately not the only one. There are often these incidences reported in the news. So we're just going to talk a little bit about abuse because this is something that you might come into contact with. It's a brief overview. Many of you may have attended courses on this topic and you may know something about this, but we're going to just talk about it. So within an abusive home, abuse can be physical, emotional, sexual, or it can be just plain neglect. So according to legislation, if anyone has reasonable suspicion, or I think the actual words that are used is reasonable grounds, that a child is being hurt, injured, abused, and does not report it, that person can be criminally charged. So the acts that govern that, and both acts say words similar to that, it's the Children's Act and the Sexual Offences Act. Before we get into more detail about that, let's just talk about the types of abuse. So physical abuse. Physical abuse, it includes beating, scalding with hot steam, where a burn results, where children are tied up, and there have been incidents of this, where children are locked up, or even women are locked up, where children are deliberately burned, either with hot irons or with cigarettes, kicking, hitting with an object, all those kind of things. So the indicators include unexplained bruises, welts, burns, fractures. Arms particularly are often broken because they're bent behind the back, or they just grab an arm and they twist it, causing a twist fracture. Abdominal injuries, an irrational fear of adults. So this again can often be seen in the faces of children. Absence, because obviously if the child's been beaten up really badly, they don't go to school until the bruises have subsided. It can cause a child to regress and wet the bed. Withdrawal, reluctant to change for PE. Children don't want to do PE. They don't want to change in front of the others. They make all sorts of excuses. It can be social difficulties. Again, here we have overcompliance, where a child is overeager to do the right thing because they're too scared of getting into trouble. Shy, and often the first signs are there's a deterioration in the schoolwork, where a child was at some stage doing fairly well. All of a sudden, without any other factors, there's a deterioration in their schoolwork. That is a red flag. Then we've got emotional abuse and neglect. So you're not allowed to humiliate a child. So humiliating a child to the point of telling them you are stupid, no one loves you, you're ugly, no one cares about you, no one would want a child like you, all that kind of thing can be said to a child. The parental indifference, where the parent just doesn't care. They just don't care about the child. Often when they lie to a child, children eventually begin to realize that something is not on when they're telling that, but they're not quite sure. Manipulation, where children are manipulated against each other or against another member of the family. Often there are threats where children are threatened. If you don't do this, then I'm going to kill myself. So those are things that unfortunately parents do say to children, and children take them seriously. inconsistencies when disciplining. That is definitely not a good thing. Then you have neglect, where there's lack of adequate supervision. So you have children running around after school and nobody knows where they are. They're not protected. They don't have clothes that fit them, or their clothes have not been washed. They're still dirty. And you do see that in classrooms. The child might be sick, or they might have hurt themselves and they've not been taken for the correct medical care. They might have fallen and broken their arm, but the arm has not been attended to. They haven't been to a doctor until they actually need to have an operation to fix it. They're not given all the educational opportunities that they need. A way that you often see this is in hygiene. You might notice poor hygiene in children, and it's because of neglect, where they have not been taught you bath every day, you brush your teeth every day, you wash your hands, you brush your nails, that kind of thing. So it basically adds up to a failure to nurture and provide emotional support. So these kind of things can have an effect, such as the child develops a very poor self-concept. They might develop a speech disorder because they're so used to being humiliated and being emotionally abused through being shouted at or being told they're no good, that they're too scared to speak. So they might start to stutter, or they might just mumble. Failure to thrive. They might just not be thriving. There might be developmental lags. Again, we see a lot of high anxiety in these type of children. There's a lack of trust. Unfortunately, emotional abuse and neglect often leads to conduct disorders, where children actually need psychological help, withdrawal and depression again. So also we have, along with that, is the hunger, fatigue, listlessness, stealing food. So children who have been neglected because they've not been given food. Some parents punish children by saying, my child came home late from school, therefore I told him he can't have lunch and he's got to wait until supper. So these kind of things unfortunately happen. So the child might end up stealing food. They might end up doing delinquent acts. And part of the reason for that is because no one cares about me. So it doesn't matter what I do. So I can do what I like. So this is a very sad state of affairs. Let's just go on to the next one. Okay, what to do if you suspect abuse, particularly sexual abuse? What should you do? What is the role of the educator? So the role of the educator is to identify child abuse, is to report child abuse to the relevant authorities, the SBST or the principal of your school. So your school needs to have a procedure or a protocol in place where every staff member knows what to do if a case of abuse has been reported to them. They know who is the person they must contact, and they know what the procedure will be. It will go to this person, that person will do this, that. This is what's required of me. The school should have that protocol in place. You are supposed to refer suspected cases of child abuse to that protocol that your school has established. So I did talk about the obligation to report sexual abuse. If you are really interested in this and you Google the Sexual Offences Act, you look at Section 54 of the Sexual Offences Act, it deals with the obligation to report sexual abuse and of a child and also of a mentally disabled person. They are dealt with in the same section. And there again, it does talk about the reasonable grounds. So when it says reasonable grounds, it's not just a hunch or just a vague suspicion that you have, but there must be some kind of factual basis of it. If you make a report in good faith, and the Act actually says this, if you make a report in good faith and it turns out to be unsubstantiated, you are protected. It doesn't work the other way around. That if you don't make a report and it is substantiated, you can find yourself in a little bit of hot water if the child says, but I told that teacher and they did nothing. So it is something to bear in mind to make sure that there is a process and you know what you're doing. When when you have become aware of abuse, it's important to keep a record of the incident, exactly what happened and how you came to become aware of it. Write it down somewhere, keep a report, date it, the place and the time, the relevant names of the people that were there. So if it was just you and the child, you put it down. and then keep a record of the name of the person you reported it to. So that if it does come back and says, but I did report it, and that person I reported it didn't do anything about it, you have got the record to protect yourself. So it's a very, it's something that you really must take care to do properly. So I've spoken about what the role of the educator is. So the role of the educator is not to investigate the case. You don't do any of the investigating. You report the case. If it's I think it's a level 4 offence, then it is the duty of the police or one of these child protective organisations such as the Teddy Bear Clinic to do the investigation. It's also not the teacher's job to examine the child. So sometimes there are bruises on the child that are visible to you because they're not under the child's clothing. Sometimes the child will want you to have a look. In that case, you have to say to them, no, we must go and talk to Mr. So-and-so and I'll be with you and we'll show them. In other words, you're following the protocol that your school has set up. You can't take pictures of it. Remember, there's the PARIYE Act and all sorts of things. You can't take pictures. So you need to follow the protocol that your school sets up. It's not your job to condemn the offender. The offender might be the parent, and the child is already confused because the parent's done something to me that I feel uncomfortable about, but I still love the parent. So it's not your job to condemn the offender. And another thing, don't make promises you can't keep. So often the child will say to you, ma'am, please don't tell my mother, or please don't phone my parents. You cannot promise to not do that. You have to explain to them what the procedure is and how you can best help them. When a child is disclosing to you, there are some important responses that you should do, because often this child has told somebody else and that person hasn't believed them, or they've swept it under the carpet. So the important thing to do is to say to the child, I believe you. I'm glad you told me. I'm sorry this happened to you. Another big thing, it's not your fault. Because quite often, particularly with sexual abuse, the abuser or the perpetrator is going to tell the child, this is your fault. It's not mine. I can't help myself because it's your fault. So the child already feels like it's my fault. I'm guilty. No, you need to assure them that it's not their fault and they are not in trouble. Then you also need to tell them, I need to speak to other adults in order to help you. And then according to the protocol in your school, you need to explain how that happens when you are telling them about that. You need to, so that they know, and then you need to tell them that you are there to support them. Now, this green book here that I've put a photograph of, it's called The Protocol for the Management and Reporting of Sexual Abuse and Harassment in Schools. This is a very, very useful manual. You can Google the name of this manual and it will come up and you can download it. So in this manual, it defines a whole lot of terms so that you know exactly what the terms are that you're talking about. It gives you steps to follow. It gives you an idea of how to set up a process of how to manage it. It also gives you a table of the level of offences and what to do and what the red flags are and how to handle it and how to manage it. And it gives the school a lot of reassurance that you have actually you can set up a protocol in your school and you can manage these kind of incidences so that there's a good outcome for everybody involved. And the child can be helped, and best of all, that the abuse can stop and the child can feel much more comfortable about themselves and the way forward. So it's a very, very, very handy little booklet to download, and it is available to download if you just put in the name of it in the Google search bar. It will come up and it's free to download. Okay, so we have discussed some very serious issues here this morning. However, it's good to remember, and please remember this, it is good to remember that most of our children have loving homes, and just by building a relationship with the child and with the family, it means the world to that child and that family, that they know that there is somebody or some organization or some institution that is supporting them, that understands them, and that has given them some kind of help. Just by listening and just by being there for the families is actually something that can really, really help them. But as I said, we've discussed some very serious issues, but the majority of our children, thank heavens, do not have to deal with this. But unfortunately, there are children living in these circumstances, and we need to be able to help them. Okay, let's go to the last slide, because I think we've spoken about a lot of serious stuff this morning. Okay, let me just get rid of that. Okay. On a lighter note, I want to say that it's important to note that if possible, you must please attend the online sessions and or watch the recordings for the information that is given out. This is very, very important. It came to my notice and to Monet's notice that a couple of students were finding the first assignment a little bit difficult because they didn't know where it fitted in and how and why we did it. So obviously they missed this online session and didn't manage to look at the recording. So please, 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 if possible, attend the online sessions and watch the recording. And I know that not everybody is able to have been here this morning. So if you're in contact with other students, please explain to them what is planned for the next online sessions. So I've set it up this way. So the 10th of May is the next online session for us. In that online session, I am going to discuss Unit 4. I'm leaving Unit 3 for the moment, and we're going to go to Unit 4. The reason that I'm doing that is that Unit 4 discusses parental consultations. So I'm going to do a session on parental consultations next time. And in that session, I am going to give you guidelines for Assignment 2. Assignment 2 is on parental consultations, and that assignment is due on the 9th of June. So at that session, I will deal with parental consultations, and I will give guidelines for that assignment. Then on the 31st of May, online session 6, I'm going to jump to Unit 5. And the reason I'm going to do that is because of your third assignment. Your third assignment is very, very important. This assignment is on home programs and games. So in that session, I'm going to discuss games, and I'm going to give you guidelines for Assignment 3. Assignment 3 is due on the 7th of July. If you look at the school calendar, the 7th of July falls in the school holidays. But if you look at the requirements and the criteria for Assignment 3, you have to have done a game with your child. So that is why I'm going to address it on the 31st of May, which gives you time to meet the criteria for that assignment. I think that's all I've got to say. Engaging parents helps build successful relationships in the classroom. Thank you. I'm going to stop sharing now. If there are any questions, I will answer them. Is this the name of the manual that you're asking for? Okay, I will repeat the name of the manual. It's called Protocol for the Management and Reporting of Sexual Abuse and Harassment in Schools. So I'll see if I can type it quickly. Oops. Sorry, a pop-up happened. There. Protocol for the management and reporting of sexual abuse and harassment in schools. And yes, I will put the slides on Moodle. If you want to see all the presentation slides, please look when you go to Moodle and you're on the landing page, down the left-hand side, you've got the menu. Scroll right down to the bottom where it says online presentations. And if you click on online presentations, it will open and all the slides from all our sessions are there. Under each session, session 1, session 2, session 3. And I will put these slides on there as soon as the session is finished. Are there any other questions? Anybody want to ask anything?
Okay, thank you very much, Dr. Liz. I think we are done for the day. I don't see any other questions and queries coming up. I'd like to thank Mr. Dion for his presentation and Mr. Musala for his presentation, and to all the students who have stayed with us all this time this morning. It's been a very interesting, fruitful session, and good luck with doing all your assignments going forward. Thanks very much, everybody. Stay in touch with the tutors. Bye for now.
Bye, everyone.